All right, it's about that time. Good afternoon, everyone. This is the City of Grand Forks Virtual News Conference for Monday, April 27th, 2020. We have a pretty full panel today, so we'll get things first for the media. Once we get to Q&A, use the hand raise feature, and we'll get to your questions. You guys have, we've done enough of these now that just want to reiterate that that's how we'll know how to call on you. And to get things started today, we'll go to, as we usually do, with Mayor Brown.
Well, thank you, John. So again, welcome to the Grand Forks Virtual News Conference, Monday, April 27, 2020. Today, I'll make an opening statement, and then we'll hear from Debbie Swanson, Director of Grand Forks Public Health, Joshua Deere, Medical Director of Primary Care at All True Health System, and Lieutenant Matthew Beatty with the Salvation Army. After that, we'll have questions and answers, and then a closing statement. So I want to say good afternoon, and thank you for staying informed. It's nice to see the warm weather moving to our area, and I encourage everyone to get outside and enjoy it. Being active outside during these times while physical distancing is good for both your physical health and your mental health. Remember to continue practice physical distancing, sanitizing frequently used surfaces, practicing good hygiene, and wearing face coverings when in public settings. Like Debbie Swanson has said, your mask protects me and my mask protects you. It's important we take responsibility for the health of ourselves and our neighbors by following the CDC guidelines. As a reminder, there was a mass testing event this past Thursday. The tests were administered to LM employees that had not been tested, close contacts to LM employees, first responders, and symptomatic individuals over the age of 12. Our local health systems in the state of North Dakota are continuing to test proactively, and we expect our positive case numbers to continue to increase as part of our joint efforts to identify and contain the virus in Grand Forks and in the state of North Dakota. We have Public Health Director Debbie Swanson available for further details. For those under quarantine, know someone who has gotten the virus or has contracted the virus themselves, please know that your community is here to support you. We've been working closely with community partners to get meals to individuals and families in need while quarantined. For information on food resources available, please go to grandforksgov.com/resources. We know this is tough, and that's why it's so great to live in a community that cares. As part of this caring community, we have Lieutenant Matthew Beatty from the Salvation Army to give an update on all the great work they're doing to help those in need during this time. The city is working closely with the Global Friends Coalition in the effort to get translated verbal and written informational materials to new Americans in Grand Forks. We are a welcoming community, and we are working collaboratively with our partners to ensure everyone is informed and can follow the CDC guidelines and recommendations. As I have said repeatedly, we must not succumb to disparaging remarks that target individuals or groups of people based on their backgrounds or beliefs. That is not who Grand Forks is, and those actions fall far below any standards of expectations of decency. We are better than that. And lastly, I've been meeting with community, institutional, and business leaders over the past few weeks to come up with a smart restart plan for Grand Forks. We expect Governor Burgum to release his plans with recommendations and guidelines sometime this week. We're monitoring everything closely to align our state and federal partners and execute locally inspired, locally innovated, and a locally led restart plan. However, it's important that business individuals continue to enact and follow CDC recommendations. The Smart Restart Grand Forks plan will require individuals and businesses to follow specific guidelines and recommendations. So it's important everyone demonstrates their ability to follow the current guidelines in place. And now we'll hear from Debbie Swanson, Director of the Grand Forks Public Health. Debbie.
Thank you, Mayor Brown, and thank you, John Bernstrom, and to the members of the media who are present today, and those of you that are watching from your work or your home. Today, I'm going to tell you a little bit more about the results of the testing event that was held at the Alaris Center last Thursday. A total of 714 people were tested, and of those 714, 649 tests were negative, 62 tests were positive, and there were 3 tests that were inconclusive. The number of positive tests was expected since the event, as Mayor Brown mentioned, was targeted to contacts of positive cases, additional workers at LM Wind Power that had not been tested yet, and persons with symptoms of the disease. The North Dakota Department of Health laboratory reports by counties where cases live. This is the process that initiates what's called contact investigation here locally in Grand Forks. Positive cases reported to Grand Forks County by the North Dakota Department of Health Laboratory have been assigned to our contact investigators, and this is a really important component to the containment strategy for COVID-19. Grand Forks Public Health Department also has a plan to call all participants with negative results this week. It's important to remember that some individuals with positive test results from the testing event may live in other jurisdictions in the region. Thus, the testing event data may not line up with all of our county case numbers. Other providers in our community continuously provide testing, including Spectra Health and Altru Health System, and they focus their testing on those with symptoms, healthcare providers, hospitalized patients, and other criteria. Just for review, if you have been watching the North Dakota Department of Health website for cases that have been reported over the last 3 days, there were 3 reported cases on Saturday, 22 reported on Sunday, and 36 reported today, for a total of 61 new cases. Now, while that number is very close to what was reported in the testing event, those numbers don't line up closely for all the reasons that I just mentioned. I also want to let everybody know that several private testing events are scheduled or have been conducted in the region at places where the most vulnerable residents of our community reside or receive services. This includes congregate settings such as long-term care. This is an important focus of testing events now, as we know the disease can disproportionately affect the elderly and people with other health conditions. Thank you for this opportunity to provide this information today, and I will remain available to answer any questions following the prepared remarks from our other speakers.
Thank you, Director. Now we'll hear from Dr. Joshua Deere, Altru Health System. Doctor.
Thank you, Mary Brown and Debbie. I'm Dr. Josh Deere, Medical Director of Primary Care at Altru. Thanks again for the opportunity to join you all today. Over the past several days, our public health partners, as well as some private entities, have undergone mass testing events to understand the impact of COVID on our community. We at Altru are grateful that these events have taken place. As community members, you may wonder how you can get tested. I'd like to remind you that if you are experiencing any symptoms of COVID-19, you should contact our screening hotline and we will test you. Altru will continue to be available for general community testing 24/7, and Sick Clinic remains open 7 days a week. To date, we've tested 2,368 people. We test an average of 60 people per day and have supplies to continue to do so. Those who have a tested Altru can expect their results in 72 hours. The vast majority of those we've tested are recovering at home or have already recovered. We're caring for 4 patients in our hospital as of now. That's 1.7% of the positive cases in Grand Forks County, which is below the projected model of 5 to 15% hospitalization rate. As we enter the 5th week of virtual learning, the 6th week of many business closures, and the 7th week of COVID testing in Grand Forks, seems like a long time when we all reflect back. It's a good time to take a moment and check in on those who may be struggling. This has been a long road, and as of today, the end is not near. As a family medicine doctor, I know the impact these kinds of changes and challenges can have on everyone's mental health. Remember that it's okay to be stressed. It's okay to be anxious. It's okay to be scared. Take the time to recognize the impact, and if you're struggling, reach out for help. Your healthcare providers are still here for you, no matter what you need, either virtually or in a clinic setting. Thanks again for your time.
Thank you, Dr. Deere. Now we'll hear from Lieutenant Matthew Beatty with the Salvation Army. Welcome, Lieutenant.
Thank you, Mayor Brown. Appreciate the opportunity to share a little bit about what we're doing. As most people recall, the last time we had an all-hands-in event for the Salvation Army was the '97 flood. Now, with the obvious differences in what's going on then and now, inside the Salvation Army at that time, we were able to tap on resources within the state and outside the state and actually across the nation. So that's how our response differs this time. We are to handle this internally with our own Salvation Army here. We don't have all that resources of staff coming into Grand Forks. So that creates a little difficulty for us to do a response with such a smaller staff. So right away, we implemented a drive-through food pantry, which was going along with the zero contact recommendations from not only federal, but state and city officials. Our staff are masked and wear gloves, PPEs, and a person would call in for an intake on the phone. We do the intake by phone. They would schedule an appointment time. They would show up. We would wheel the carts out with the food box in the back of the vehicle. We would have them pop the trunk or or the tailgate, whatever be the case, we would put the box in the car. And this is the safest way. It's a no contact for the client, no contact for our staff members. So this is what we implemented on March 18th. And since March 18th, we've done 532 food boxes. And to give you an idea of the need in the community, we normally do between 225, 250 in a similar time frame last year. So that's quite ramped up. And of those folks coming in, almost half are first-time users of the Salvation Army, never gotten anything before. So we are seeing quite an increase in new clients as well. We are assisting public health as well with breakfast deliveries for those in the homeless community who are having struggles, and along with the Northland Rescue Mission, who's doing an outstanding job with that as well. We did support the 2 mass drive-through testing events, served over 350 beverages and snacks over the 2 events, one being at LM Wind Power, and of course the last one at the Alerus Center, which was mentioned. We will also continue to support those as we move forward. If there are more needed, we will absolutely be there to support our state, local, federal officials, and the National Guard as well. We're in this for the long haul. As far as the LM event and the Alerus Center, we did have, of course, as you know, families test positive. We do deliver to anyone who has tested positive within the community. So we've delivered 30 boxes to 166 people, counting all the families together, in the last week and a half since we started this. So if anyone is state order quarantine or has tested positive, we will deliver a food box to your home, and we'll continue doing this too as needed. We have a great partnership also as well. I want to mention that with our other food banks in the community. We're all looking out for each other. If we have something extra, we call them. Same, they call us. If they have something extra, and we've really combined our resources, which is really awesome to see this collaboration of all of us working together for the greater good in Grand Forks. On a bigger scale now, we have obviously people handle this crisis differently, as seen. Some people who are introverts might be okay with being inside, but a lot of us aren't. It takes an emotional, spiritual, physical toll on us. So we have established an emotional spiritual care hotline. And the Salvation Army Northern Division, which we are a part of, has introduced this hotline, which runs runs 7 days a week from 8 a.m. to 8 p.m. Central Time. And I'll give the number now, and it's on our Facebook page, but it's 877-220-4195. And if you don't have a pen, you can look at our Facebook page or call our office and get it. And like I said, this helps people deal with it. Most individuals, families, they're experiencing a higher normal level of stress due to the direct and indirect effects of COVID-19. So this hotline is for anyone who's feeling lonely, fearful, hopeless during this pandemic. They can call the hotline, reach out, hear a friendly voice, reassuring voice. Trained Salvation Army officers throughout the 11 states of the U.S. Central Territory are on call to answer these. And they will be available. This hotline will be available until we are through this.
Well, thank you, Lieutenant. I remember how happy we were to see you in our neighborhood after the flood of '97. So thank you for the good work you're doing. And now we'll turn it over to John for questions and answers. Mr. Bernstrom.
Thank you, Mayor. We'll with the media, we will with the hand raise feature, we'll start calling on them. We'll start with KNOX. Go ahead.
For Director Swanson, Dr. Deere, how many of the 231 positive cases in Grand Forks County have been asymptomatic?
I don't believe an analysis has been done on all of the 231 cases in Grand Forks County. I do believe that did happen with the very first LM Wind Power event, and I can try to look up that data for you and get back to you with it. But I'm not aware that that analysis has been done for all cases. And I also don't believe it has been attempted for this last event that we had with the 714 people that were tested. It takes a lot of effort to do that, and it requires that we review all of the information on forms that people fill out. What we do know is that there are a number of people that test positive without symptoms.
Thank you, Deb. Next question from Mr. Neil Carlson with iNews.
Again to Ms. Swanson, since it appears most of the employees of Simplot didn't take part in last Thursday's mass event, but yet the next day, one of them they confirmed tested positive. Will anything more be done with Simplot employees? Will they be reached out to come forward for testing, or what happens with that population?
The testing event was initially offered to Simplot employees, but their company declined to share that information with their employees for a variety of reasons. We did have some employees that did come through the testing event, and they were tested, and those results will be shared if they haven't been already. I'm not aware of any efforts that the company has to test all their employees, but they did reiterate that they have an employee benefit that covers testing. We also know that testing is generally available free. And so if any individuals in anywhere have symptoms of COVID-19, they can seek testing.
Thank you, Deb. Next question from Mr. Joe Bowen. Joe, go ahead.
Yeah, Neil's question is pretty similar to mine. So do you guys indeed then have a plan or a hope or a design or whatever to try and test any more Simplot employees?
Grand Forks Public Health Department doesn't have a plan to address specific businesses at this point unless our contact tracing indicates that we should do so. But what we do know is that the state of North Dakota is very interested in increasing efforts of testing all over the state. And right now they are focusing their efforts on long-term care facilities for both residents and employees, as well as some other congregate settings.
Thank you, Deb. Mr. Chris Larson from the Flag.
My question is for Dr. Deer and Deb Swanson. We obviously know that this is taking a toll on mental capacities and things like that. Have you guys seen an increase in calls relating to that at all?
From an Altra's perspective, we don't have any specifics on that. From my own clinic perspective, as I'm still in clinic, I have seen an uptick in video visits regarding this topic. And it's been a real nice way to actually reach out to my patient population during this pandemic time.
Thank you. We'll go to Matt Henson from WDAY.
This message is for Mayor Brown. Mayor Brown, based on, I realize it's all up to the governor and what he decides to do with the, businesses, but based on the numbers you have seen, because you have the advantage of 2 mass test events, do you feel it's safe to open bars and restaurants and shops again in Grand Forks, given the knowledge you have from the 2 mass tests, unlike any other mayor who had no other mayor has numbers to play with like you do?
No, I think that's up for further discussion, but no, I would be hesitant to open everything up. But I do think if we use CDC guidelines and best practices, we can probably have a soft opening gradually to allow people to get slowly back to work. But I think very positively that the governor and his staff will have great ideas for us to work together on this.
Mr. Ryan Cunningham from KNOX.
Dr. Deer, we are now 32 days after the first positive case from the Smithfield pork production plant in Sioux Falls. And in those 32 days, we have a grand total of 65 people that are hospitalized anywhere in South Dakota. How much more data do we need before we can come to the conclusion that we can't really overwhelm our healthcare system in Grand Forks?
Yeah, that's a good question. I think that we're preparing for those scenarios that none of us want to think about. That said, the peak onset of severe illness is 7 to 10 days. So as we have these positive tests coming in, if you look 7 to 10, 2 weeks out from those positive mass testing sites, we're gonna have a really good idea of a large swath of population that could be positive on how it's gonna directly affect our health system.
Thank you, Dr. Deer. Mr. Joe Bowen from the Grand Forks Herald.
Yeah, hey again. So last week, Debbie, you were saying, or at least made it sound like the decision to try and test Simplot employees was made because they're a large manufacturing plant and circumstances led you guys to believe that that might be a place where there's like congregate shared workspaces. Is the plan then to test people at other large operations in town, such as say Cirrus or the North Dakota Mill?
We would definitely consider that if through our contact tracing, we find that there are a number of individuals in a common workplace that all test positive. That would help guide our decisions, absolutely. At this
Thank
point in time, we don't have the resources to do that as a health department, and it would have to be, any of those decisions would have to be made in consultation with the North Dakota Department of Health.
Thank you, Deb. Next question from Mr. Neil Carlson at iNews.
Mayor Brown, as this drags on, are there starting to be budgetary concerns? More specifically, have different department heads been told to get rid of overtime, such as the police department?
Well, cities have reserves that they're required to keep by law to keep their bond rating as a good to reduce the interest rates we pay when we do our bonds. So right now we were looking, our budgets are good through the end of the year. So yes, we minimize what we're spending as a city on capital improvements and things that can be postponed. But right now we want to keep our workforce healthy. So we're staggering shifts and splitting people up to keep them healthy so they can do their job. But right now, projecting to the end of the year, our budget is good.
Thank you, Mayor. Next question from Mr. Matt Henson.
Yes, this is for either the mayor or Debbie. Now, I've heard a lot of LM employees bring this up. Because there is at least 3 known cases traced back to Simplot, I realize this could come at the state level. Is there a push, though, to have all the employees at Simplot quarantine for 2 weeks? I understand the plant's closed, but is there a push to have these employees quarantine for the next 2 weeks?
Not that I'm aware of.
Okay, Mr. Chris Larson from the Flag.
Mayor Brown, I know this isn't happening in Grand Forks, but there's a report over the weekend of a barber shop in Dickinson whose owner says that regardless of what the mayor or what the governor says, he's opening April 1st. If this happened in your community, what would you be telling that barber?
I would say, please follow the CDC guidelines. We encourage voluntary compliance with the CDC guidelines. I would say, please don't do that. And if you have to wear a mask, make sure your customers wear masks. I don't know how that would affect your haircut, but I think that we do encourage people to maintain physical distancing, wash frequently used areas. But no, I would encourage voluntary compliance. But I understand his impatience. He wants to get back to work.
Thank you, Mayor. Mr. Joe Bowen.
So to clarify what you were saying earlier, Debbie, then, has contact tracing called for or otherwise indicated a need for mass testing anywhere beyond LM wind power?
Not that I am aware of today. However, keep in mind that we did get a number of new cases today, and it's very possible that they may be linked between work sites. And so we will definitely be looking at that information as it becomes available to our regional epidemiologist and all of the staff that we have working on contact tracing. And if we do find that there are a number of cases that are epidemiologically linked, we would definitely take the necessary action.
Thank you, Deb. Mr. Ryan Cunningham at KNOX.
For Mayor Brown, you mentioned that you would be reluctant to open things, at least in a wide open type of capacity. So kind of 2 parts here. Number one, what does a soft opening look like for you? For example, say restaurants versus bars. And then secondly, you know, for the last 10 days, the data that has come out from serology tests to mass viral load tests to other figures around the state, or around the country rather, have all indicated that we simply can't get to that point of overwhelming our healthcare system. The death rate's been overstated. What more data do we need before we start advocating for the city to be able to reopen?
I think the data is coming in. So I think we look at the data, but I think restaurants might be like 1 table every 10 feet with family groups, not just groups of multiple people. And I don't see bars being the first thing to open because of the congregation, but we'll see how we talk that out, how we work that out. There's nothing written in stone and it's all speculation at this time.
Okay, Mr. Neil Carlson.
Yeah, I guess for Debbie Swanson, I get a lot of messages from this company and that company, some very small, some a little larger in Grand Forks, that this or that one, single employee has tested positive for COVID. Can companies, smaller companies, come forward and go, Joe Blow tested positive here and I've got 12 employees. Can we all just come in and get tested, or how does that work?
Well, I First of all, I think we would need more information than just one employee. If you think about the effects of a large workforce and all the contacts that they may have within the community, it's likely that we'll have one person at one business and one person at another business. So I think to make a determination based on companies having one person test positive, that's not really how contact tracing works. How it works is when that individual has a positive test, they identify who their close contacts are. So it may be their coworkers, maybe their family members, it may be a combination of both. Those are the people that we want to inform and then have them self-quarantine or possibly be tested if they develop symptoms. We don't simply test just because one person in a business tests positive. We don't have the resources to do that. Quarantine and isolation are absolutely our best tools. We know that they're challenging. We know that it's difficult for people to do that, but they really are the best way to prevent the spread of person-to-person transmission of this disease.
Thank you, Deb. Mr. Matt Henson, WDAY.
This is for Debbie. Out of curiosity, how many first responders tested positive from last week's event? And is that going to place any hardship on the first responders in Grand Forks?
As I mentioned before, the testing positive results are just now being called out to those individuals. It started over the weekend. I don't have an analysis of how many people who have positive tests were in any of the individual groups that we tested. That's going to take some further analysis. If we find that someone is a first responder, we certainly will work with their agency to ensure that everyone remains safe and healthy and that we do what's necessary. And when we did decide to test first responders, we did let them know that if they find that they do have a case in their workforce, they will have to address it.
Thank you, Ms. Swanson. Mr. Joe Bowen.
Hey again. So this is a question I got from the community at large. Is it safe to have city buses running right now?
Yes, city buses are essential. The Lieutenant Governor has discussed that with us because they're essential for people to get to medical appointments, pharmacy appointments, get groceries. So transportation is essential for those most that need in our community. We would encourage people to enter the back of the bus, wear your mask, and sanitize the areas where you sit. But I know we do that periodically throughout the day. So yes, city buses will continue running as far as I know, and they're essential.
Thank you, Mayor. Mr. Chris Larson from the Flag.
This is for Dr. Deer. Dr. Deer, there's been a lot of talk of serology testing. Has that come to Grand Forks yet? And if not, when do you expect it to come?
Yeah, there's been a lot of research on this, and I think that this is something that we'll be looking into closely. We do have our partnership with Mayo, and Mayo has been a leader in Minnesota state testing. So their expertise will likely guide us as to when and how we'd institute any testing along those lines.
Thank you, Dr. Deer. We got time for two more. Mr. Neil Carlson from iNews.
Lieutenant Beatty, probably have some people out there with time on their hands, and/or are there any specific donations you guys need?
Yes, right now, food obviously is a big one, and money is also a big one. With our thrift store closed, that's a big source of income for the Grand Forks Salvation Army, and that's closed indefinitely. We do have volunteers have stepped up in the community, so volunteers are not an issue. We've partnered with Hugo's too as well, so we do have a food line open. Once our food bank runs out for the month, we get a once-a-month delivery from Great Plains. So we do have a backup in place, and we've had to access Hugo's. Of course, that takes money to get. So food and money would be our number one donation request.
Thank you, Mr. Beatty. And Mr. Joe Bone from the Grand Forks Herald.
Yeah, this is another community question. So is Altru doing any retesting of any samples it's collected for like coronavirus testing? Apparently this person tested negative for the flu, but didn't get tested for COVID a while ago, it sounds like, when the testing protocols are more stringent. So you guys retesting anything for coronavirus?
Yeah, there are rare occasions in the inpatient setting that we have retested patients, and that would be a clinical picture that would warrant it.
Thank you, Dr. Deer. Thank you, members of the media, for joining us this afternoon. Thank you to all of our panelists. And as we have done every news conference, our final words from Mayor Brown.
Thank you. I want to say thank you to our public health team, first responders, and public works and waterworks crews for all the work they do during this difficult time to keep us safe. No matter how tough the circumstances are, they still get the job done in such a humble and professional manner. It's important everyone continues following the guidelines. The virus does not spread itself, we do. And we do need to take these measures to protect our at-risk populations. So stay home, slow the spread, and save lives. We're in this together, we'll get through this together, and together we'll emerge stronger. Thank you.
Thank you, Mayor. Thank you, everyone. That will wrap up our news conference. Everyone have a good Monday.
Thank you.